1988, I had my first lot of surgery, but it was preceded by long-term wear and tear, running around on busy maternity ward was the last place. Also general medical, surgical, all sorts of places like that. Just the overall usual type of injury that nurses get, which is overall long-term wear and tear. In fact, I kept working to the very end. And just put up with it, took analgesia and just put up with it, and then eventually it got so bad that I tried to find light work, but my back had deteriorated so much I had to go ahead and have surgery, a fusion anyway. And so that was the end of my career as a nurse, and it gave me, one good thing out of that was positive, was that it gave me time to think about what was going on. I lobbied ministers, I wrote articles, and then I did a big report because I got angry at seeing other nurses treated the same way.
Manual handling injuries in particular are the most common injuries amongst nurses, accounting for about 84% of injuries. Nurses were really being used as human lifting machines prior to the no lifting policy.
There is an absolute onus on organisation and management to actually reduce the risk associated with tasks in the workplace, risky tasks. And I don't think nurses have ever understood that.
The report that I wrote was called Buried But Not Dead. The reason I called it Buried But Not Dead was because what happened is nurses get injured, they get lost like me out the workforce, and basically they are buried in the system. The system just says ta-ta and leaves them alone. So I thought, oh well, we're out there, but we're not dead. But you don't know about us, and no one's going to know about us unless we kick a bit. Once the report had been written, I thought, well, I can see this though. It could be a dead report. So I thought, I'm not going to let that happen. I don't want another dusty thing sitting on the shelf. So then I went and hit the media.
A study of nurses in Victorian hospitals, for instance, has revealed that too many are being injured. And in 73% of cases...
we then had the profile. So we had the report and the profile to go to the minister. And also what happened was the ANF decided to then publish it in a book form.
Someone told me that actually they must have been listening to Radio National, and to listen to this woman from Victoria, there was something going to be on about the lifting of patients. And I contacted her after the interview. I tracked her down and rang her here in Victoria and sort of said, look, you'd be really interested in what I do, because what you're saying is what I'm doing.
Let yourself stand up, okay? That's it.
I was looking at it from a point of view of my background was health and safety, so I'd already developed this program, but she was here in Victoria and instinctively knew what was needed here.
I was invited to this International Nurses Day breakfast, and the minister was there, and Belinda Morrison brought him around to all the tables, and I was on the special interest group table. And I thought, oh, well, this is a good chance. And as he was being introduced, I said, hello, and it's nice to meet you, Dada. Look, we've just done this big report, and nurses have a real big problem with back injuries, and there's some awful reports, statistics and things happening to nurses. Could I get an interview with you to let you know what's going on? Well, he couldn't very well say no that day because it was International Nurses Day. And I knew that I needed assistance with this, so I asked Jeanette Cedrinis of the ANF to accompany me, and so did Anne-Marie Scully, who's from the ANF senior rep, because, this was starting to get out of my league at that stage. And they had a bit of a plan and a proposal for some money, some seed funding.
There was a lot of support for the policy. One of the major problems for the industry was, well, we don't have the money to be able to buy equipment and provide the training for nurses in no lifting techniques. So we approached the Minister for Health, and he actually agreed to establish a project in the public sector to start off with. And that was done through the Department of Human Services. And the aim of the project was to provide funding to public hospitals in the state and public aged care facilities to implement back injury prevention programs based on the ANF no lifting policy.
We might get you to help a little bit if that's all right. Just to bring your knees up. And on 3, we're going to...
We actually started the introduction of the No Lift program in 1999, and initially we worked very closely with Louise O'Shea. She came across and she helped us introduce into the one ward, and I really was one of the students at that time. We went through really what is happening, what are we doing to the patients, how do we move them, what issues are harmful to nurses or potentially harmful, and I basically took it over from there, and we've been teaching it right across the hospital. We're actually going back to the wards over and over again and talking to staff and say, do you still have manual handling issues where you do feel a slight ache or pain, and how can we make that better? How can we improve it all the time?
Yeah, does she sneeze? Right, we're right. Yep. Excellent.
The program has been extremely successful. The staff injury claims, the financial side of it has dropped by 87%, and I think that speaks for itself. And while most of Australia really is struggling with paying their insurance premiums, the Northern Hospital has had a reduction in insurance premiums over the last 4 years, and we're expecting another cut this year. The brakes back in, we'll lower you down. How was that?
One thing that does annoy me a little when I look at recruitment notices, they say, such and such a hospital says, we've got things like Table 8 uniforms, or we've got critical care, and we've got this and all the medical stuff that a nurse wants to learn about. But there's nothing about, we have a no lifting policy. We come to our hospital and we'll look after you. Your physical well-being. No one does that. I think. Hang on, tell a lie. Maybe 2 have done it. But that's still not a selling point, because it still shows you that nurses' health is still down there.
Traditionally, we would have had to, because of the confined spaces, you would not have been able to do this, to use a lifting machine to put the gentleman back to bed, and it would have been a lift. It would have been either top and tail, or some sort of 4-man, 6-man lift to get him back into bed. So the benefits of this, it's all mechanical, and we have far less injuries.
We've got a long way to go, but nonetheless, we know that if we keep on going with this program, we are going to significantly impact on the injuries and make the job more appealing. But until the occupational health and safety features of it are greatly improved, I personally wouldn't want any of my nieces or nephews to go nursing at this point in time, because there's still too many injuries. Now, they are dropping, but we've got a long way to go. In most places, it's only at the beginning part of it. There's still a big rollout, and that's going to take several years. But it is happening, and that's really nice. And when we get the results that we got, it's very satisfying. You think, something worthwhile came out of this situation. So, yes, I'm very pleased.